All right, we're drawing a name. The name is Teresa Isbell. Is Teresa Isbell here? Going once, going, gone.
Okay, Fran Horning, she's working.
Fran Horning, she's working, so
Does that count?
she registered? Yeah?
Okay.
Yeah, Fran Horning, she's winning a fanny pack.
Okay, Dr. Rose, you can go ahead and announce, and I'm out of here.
Okay, all of you guys are in for a treat today. We have next, as you can see, the Casanova facelift. We have Dr. Alireza Panahpour. I hope you guys have heard of him, or maybe you not have heard of him. He comes from 4 generations of dentists and oral surgeons. He practices biological integrative dentistry in Beverly Hills, California, 90210, and is the author of The Good Dentist. I read his book last year, a very, very good book. It's called Good Dentist, Save Your Teeth, Save Your Life with Mercury-Free and Systemic Dentistry. He is asked regularly to speak at holistic dental and systemic dental meetings and naturopathic students worldwide. If you've heard of that thing where, you know, you learn more from your failures, you learn more from adversity. There isn't a dentist that I know has been through a lot more adversity than him. But the truth is that his passion, his drive always comes first. And when I was talking to him the other day, he was saying, I go, why do you continue to do this? And he goes, because I love it so much. And that's a common theme amongst all of us here, which is we do this because we have people to help, and we'll overcome and survive. Because people like him, his passion, his drive is really what helps all of us continue to move this movement forward. So it gives me great pleasure to introduce Dr. Panahpour.
Thank you. There's always like to get to know my audience, but there's one specific person in the audience I want to introduce him to you guys. He's one of my first mentors, one of my early mentors. I've truly been blessed to have these amazing mentors that allow me to sit on their shoulders and see a little further than them. He's probably the only dentist I know that runs a medical facility in the world. So can you imagine a dentist running a medical dental facility? So I want to introduce you all to Ara. Ara, please stand up. As a young dentist, Ara Klinghardt was one of the first early doctors that I met, and they truly helped me to make a shift in this paradigm. Thank you, Ara, for all you've taught me, for all you've shared with me. Beautiful heart. Okay, so my name is Alireza Panahpour. I'm of Persian descent, born in the faith of Zoroastrianism. I grew up in military schools in England, so I have a bit of a warrior in me. You know, I had to take histology, physiology, biology, chemistry, you name it, in order to get to dental school. Now that I'm in dental school, well, what these all these pre-courses that I took, what they all have in common? The periodic table. Now that I'm in dental school, you're telling me that the second most toxic substance on earth, and let me remind you, number one being plutonium. And what do we do with plutonium? We make atomic bombs with. And number two, mercury. So how could any amount of mercury be safe? I don't care how many research you show me. I don't care how you present it. It just doesn't make sense. So I would walk around in dental school with mercury vapor mask. So that's where my challenge started. I take a lot of courses. If I hear of someone in, I don't know, Zimbabwe that's teaching a course on dentistry, believe me, I am there. So I took a lot of different courses and basically put them all together in order to help my patients, anywhere from biomimetic dentistry, surgical interventions, what have you. And in all my lecture, I always ask my audience, and I'm asking you today, when was the last time you took a course in adhesive dentistry? Good. When was the last time you took a course in restorative dentistry?
About a year ago.
When was the last time you took a course in surgical dentistry?
I'm an orthodontist, so I see surgical orthodontics.
Okay, so I recommend always continue education. The protocols are changing so fast, and I'm going to share some of that with you today. Okay, every 2 years, I am on a roll. I make sure I take updated courses with my mentors to keep up with the latest techniques and protocol. This is going to drive me crazy. So, I've been called a lot of different names: biological dentist, holistic dentist, alternative, quack, systemic dentist, organic dentist. But at the end of the day, I like to think of myself as a conscious dentist. So these names don't impress me anymore. I see a lot of you guys take a weekend course with us here, and on Monday you're a biological dentist. That kind of makes me laugh. I'm actually with a dentist right now, a very high-end cosmetic dentist. We're sharing a practice. He's part of the IABDM, IABDM, HDA. He doesn't even have an elephant suction in the practice. But he's only doing it to bring the patients in. And I see a lot of that, and that's okay. But know your limits. I do a lot of in-house training where I have dentists actually come into my office and shadow me, or I go to their office, spend days with them, and train them in biological systemic dentistry, structural dentistry, and by that I mean, TMJ, sleep apnea, et cetera, neural dentistry, biomimetics, advanced surgical protocols, PRF, PRP in dentistry, and facial aesthetics, which is my favorite one right now. And I promise you, as soon as I advance and master this, two more doors are going to open for me, so I can't wait. I'm a father of 2 children, Sophia, Ian. We do travel quite a bit together. We have a lot of fun together. We are a ski family, so we spend a lot of times during the winter in the mountains. We have a lot of fun together, and I'm truly blessed to have these little 2 munchkins in my life. This is every Sunday morning. Me and my son go dancing together, and we have a lot of fun. It's just the best, So, years ago, 2001, I had heard about, Kobe Bryant, Shaq, all these athletes going to Korea and Germany and getting these injections into their knees of this blood-driven protein. So I looked into it, and I found that actually veterinarians were doing it before that for horses. So we're talking about these huge centrifuges that would take the blood of the horse, centrifuge it, grab the PRP, and inject it. And then of course, little by little, it got approved in the States. I rented my first machine. It was about as big as, huge. And after my surgery, I would take a plasma-rich protein and I would inject it around my surgical sites to enhance healing. Well, this time I had a little bit left, and I just applied it underneath her eyes, and within seconds, her wrinkles went away. I was like, wow. Not only you go to Dr. Panahpour, get your tooth extracted, but you walk out even more beautiful. That was the birth of course, then, I see a lot of celebrities also. I heard about the vampire facelift, went through the protocol. She was doing a reality show. She comes to our office. We do this for her, and she kind of put us on the map. So that was truly the birth of the Casanova facelift. But before I get into it, I want to talk about plasma-rich fiber, plasma-rich protein. Who is doing any form of PRP or PRF in their practice? Very good. Out of curiosity, what is your G-force and timing right now? I couldn't tell you. Okay. Anybody else? Don't make me come up to you. Speak out. What is your G-force and timing of your PRP and PRF at this time? Say that again? Okay. Right. I'm sorry? 1,213 minutes. Got it. 1,213 minutes? Yeah. Okay. You know, that is 2 years ago technology. So, a few years ago, I am at a, I don't know if you guys know Dr. Picos. He's an oral surgeon. He's got an institute in Florida, and he teaches a lot of surgical courses. And I've pretty much taken every freaking surgical course you can think of in the United States, and the ones that I got my hand in Europe. So I meet a young dentist who is truly in the forefront of plasma-rich plasma protein, Dr. Rich Myron. I see him speak, and I'm like, wow, this young man, he's like really ahead of it, kind of reminding me of myself when I was his age. You know, he's about like 35, 34. I just turned 52. But I told everyone I'm 55, so they say, you know, you look really good for your age. That's a little trick you guys can use. So he has a company called PRF EDU. He had saw me on Instagram and Facebook of me doing facial aesthetics, and he's got a course in facial aesthetics, so he invited me to be a speaker. I also speak for other American Academy of Facial Aesthetics and some of these other foo-foo organizations. And of course, every time I spoke, I would be there early to hear his lecture on PRF and PRP. And for the past 2 years, every 6 months, the technology is changing and advancing. And I'm truly blessed to be a part of that. So I highly suggest that you guys take a course by him. We just had this course in Florida last week, 85 attendees. We had a great time. This is the next course that's coming up in Orange County. So PRF EDU, PRF courses. Take some courses of PRF, PRP. If you don't want to do facial aesthetics, just take that course alone to see the dental applications of latest technology in PRF and PRP. There's Dr. Myron. There's another dentist friend of mine, Dr. Anna, that comes from Portugal. She's also does a lot of facial aesthetics only in her practice, no dentistry, just facial aesthetics. Again, Dr. Myron, we're going to get into this now. I'm just going to share with you guys. So what is really PRP and PRFs? Through the G-force, through the centrifuge, what we're trying to attain is to separate cell layers based on density. So we had the PRP, which was by plated-rich plasma, Dr. Marks, 1998. PRGF, plasma-rich in growth factors, Dr. Enitwa, 1999. And then platelet-rich fibrin, Dr. Shukran from France in 2001. So that's a little latest history on that. Now, the first two use anticoagulants when they withdrew blood, centrifuge. And they were doing this at 2,700 RPMs for like 17, 18 minutes. Now, Dr. Shukran came up with what you guys are using, 1,200 for like 12 minutes, 13 minutes. Again, our goal is to concentrate cells. And don't get me started on the tubes. Don't even get me started on the tubes. There is plastic tubes based with silicon tubes laced with plastic. It's crazy what's out there. But through PRF, because Dr. Myron does a lot of the research for this big dental organizations like Siemens and what have you. So and because I'm involved with him, I've kind of become the beta tester for him. So he is doing research on materials that are coming up in 2-3 years for us. But I'm lucky enough to get my hands on some of these things. So Finally, we've gone to the tubes that we feel good with. So pay attention to the tubes that you use as well. You okay, dear? Did I say something? Make sure. So we have gone from, with additives, G-force of 1500, 700, 200. I'm sorry, from 2700, 1300, again, 13, 17. So right now, I'm centrifuging at 700 for 4 minutes. I'll get there. The names are just driving me crazy. PRFL, PRFB, PRF. It's PRF and PRP. Let's just kind of agree on that, okay? But we'll get there. Yeah, I understand where you're coming from. So this technology is changing very rapidly. So blood is collected, centrifuged. Then Dr. Myron went in and started measuring to see where is the most concentrated PRP. And guess where it was? Is this part right here. That's the most, because he started measuring it, and that was the most concentrated PRP that was found. And this is what we use. We got the slugs, sticky bone, and now we have what they call the bio-hit, or the ALB PRP. Now we're able to, we'll get there, warm up the plasma-rich protein, make it to a jelly. We can create shapes, non-resorbable membrane that will last you 4 to 6 months for surgery. This was just introduced to me last week. And if you guys get on top of it, you can start using it in your practice ASAP. So, my slugs, my sticky bone. What do I use for my sticky bone? I either use the scraper to get some of your own bone, or, depending on the patient, I might use some synthetic bone. I like Osteograph by Tulsa. It's basically they take shark fin. Has anyone had shark fin soup? A bowl is like $180. A bowl of shark fin soup. So they take, and shark is very close to us. If you look at the DNA of their enamel, fin, cartilage, are very close to human. So they've taken shark fin and shark tooth powder, and they've added bone-building protein. It's called Osteograph. So again, depending on the patient, that's what I use to make my sticky bone. Remove a infected root canal, make sure my sockets are nice and clean. Look, there is no flap here. Non-traumatizing. Who did I learn this from? Dr. Picos. I put my non-resorbable membrane, tuck it in between the gum and the bone, put my sticky bone in there, take my slug, put my slug over, and suture it up. 2 weeks post-op. Beautiful. Another case, in 2 infected root canals, cyst, 3D scan, you could see it. That's me taking the picture. After removal of the teeth, buccal bone is gone. I have a sinus perforation. This is a non-resorbable membrane that I pinned in the front and the back, carried over, close the gum. You go back in 2-3 months, take the pin out, take the non-resorbable membrane out, and let it heal. So there's a lot of application of this PRP sticky bone that we're using. Even Dr. Val Cantor, who's heard of Dr. Val Cantor? Oh my God. She's rocking this dentistry right now, especially the endo. She's using PRF as a direct pulp cap to regenerate these cells. I know root canals, you guys. I don't believe in root canals unless the periodontal ligament is maintained. 70% of the blood supply that comes to a tooth does not come from the artery and the vein that goes within the tooth. It's from the PDL. And more research will be presented on the periodontal ligament. Every time, even in Chinese medicine, they say every time you bite down, that activation of the PDL sends a surge throughout all your meridians, throughout all your chakras. So if you're able to do a root canal and preserve the PDL, or help the PDL regrow, and we're doing that research, I'm doing that research with her right now, with Dr. Myron, and that's a good root canal. So, again, effect of injectable platelet-rich fibrin to regenerate an inflammatory process of dental pulp cells. Compare this analysis to plate-rich plasma. Now, we have gone from vertical centrifuge to horizontal centrifuge. Much more powerful. This was also introduced by Dr. Myron. I've been using horizontal centrifuge for the past 8 months. I have 2 Intraspin that are just sitting. Anybody wants to buy them, you're more than welcome to. I have 2 of Shukrans sitting, but now I got my horizontal. I got 2 of them going constantly. And through the horizontal centrifuge, we've been able to, again, Dr. Myron has gone and tested layer by layer, and what we're getting is 4 times more powerful than the vertical centrifuge. This is your vertical. Again, I'm not going to get into the science of it. That's for you to take the course and to understand the science behind it. And now we're at horizontal centrifuge. So this juice, this golden juice, is much more powerful. Okay, come on. There you go. I mean, I'm not going to get into the science of it. That's not my specialty. I just like to kind of walk you guys through. And that's what it looks like. Honey, you're turning red. Something stuck in your throat. Again, as this spins, these tubes go horizontal. And again, 4 times more powerful. So we have gone from vertical centrifuge of 2,700 for 14, 17 minutes to horizontal centrifuge at 700 G-force for 4 or 5 minutes. That's a huge difference. Huge difference. Oh, I didn't know this was a video. Okay. Now, if you look at all the major labs, the big ones, they're all using horizontal centrifuge. Now, this is the new boy in town. We take the PRF, we warm it up, becomes gelatinous. At the same time, so this, we're running this 1200 or 1200 G-force for 12 minutes. Then we go and do another plasma-rich protein liquid, 700 G-force at 4 minutes, and then we mix them together. There is my natural filler now for my aesthetic patients. My patients that don't want to get fillers, they get this. This will last about 4 months for them. But of course, they always come back and say, can you give me something that lasts longer? Sure, filler if you're okay with it. And now we're able to take the same technology and create these resorbable, long-term resorbable membranes that we could use for our surgical protocols, sinus augmentation, and it's from you. See, right here, he's shaping it. So when I'm doing cheek augmentations, lips, this is what I'm using. I've been using this for a while. Again, I was one of the beta testers for it. It was introduced to the public about, 2 weeks ago. We use these for plugs, different sizes for our surgery. Of course, with my surgical courses, with my facial aesthetics, you're using the blood. What is blood? Blood is a filtering mechanism. So depending on the patient, I usually put my patients on protocol. For an average patient, not dealing with too many autoimmune issues, 2 weeks before surgery, we look at their hemoglobin numbers or have a nutritional consultation with them. We want to make sure they have enough vitamin D, et cetera, et cetera. Our patients get on these protocols to not only get their blood as clean as possible. If I have a patient that comes in, I'm taking the blood, and the blood is dark, red, oily, thick, I'm sorry, you're not the right candidate for us today. Office visit is $210, you need to reschedule. You need to go on our protocol. But when you have a patient that goes on our protocol, they come in, the blood is pink, dash of red, then I know that's a healthy blood. You can't get much out of a diseased blood, which is a reflection of who that patient is. Are you guys with me so far? Yeah? You guys are quiet. Good. So vitamin D deficiency, I can show you guys multiple research. You guys been hearing it yesterday, today. So this is the latest numbers of the deficiencies we have in the US population. So again, DK2, Dr. Myron contacted this organization that actually has made us supplements that we give to our patients. It's AM and PM. They've made it very simple. Everything is in there. So they take 2 in the morning, 2 in the evening. Made my life so easier. But if I have a patient that's really challenged autoimmune, I don't give him this. I contact their naturopath, their functional medical doctor. I have a whole different protocol with intravenous IV support, UVBI, you name it. I kind of give the responsibility to the naturopath or the medical doctor to make sure the patient's ready before surgery. I have a vitamin D tester in my office, actually. I charge for a nutritional consultation. Again, antioxidants really important. This is the vitamin D tester. I think we have a video coming up. Yeah. Come on. Oops. No, we had a video, but it's not playing, so I don't know why. Anyway, so it's very simple. Little poke, put on the machine, reads the numbers, then you know. So right then and then I know if that's how my patient's vitamin D. And if their vitamin D is low, I can only imagine everything else is low. You have to understand there's a lot of these patients that come to, especially cavitation patients. Because of their cavitations being there for so long, I promise you, that blood is diseased. So I take precautions in getting all my patients ready. So again, we talked about how the technologies, PRF, PRP, is changing. So like literally every 6 months this is changing. Now, excuse me, I heard of a dentist in Philippines that is adding gold leaf to the plasma-rich protein, and he's able to strengthen it not 4 times, 100 times. I'm looking for that guy right now. I'll be knocking his door very, very soon. Can you imagine? He's using gold, which is a great transmitter. You know, gold is used, NASA uses it for shuttles, computer people use it, there's a lot of applications. So he's using it in his spin to create this plasma-rich fiber protein that's 100 times more stronger than where we at right now. The next technology that we're working on is these spins. We're going to be adding laser technology to also add certain hormones, growth cells, even antibiotics to that plasma-rich fiber slug or to the plasma-rich protein liquid through LED technology. Okay? So, let's get into some facial aesthetics, which I love doing this, you guys. So when I took the courses with Vampire Facelift and all of that, I took that concept, that technology, I added my own flavor to it, and I created the Casanova Facelift. Trademarked it, patented, and we have a lot of fun with it. Now, with every one of your states, you have to make sure you're allowed to do this type of, for example, California just recently passed a law that dentists can do Botox and fillers as long as they have the right credentials. But it has to be part of their treatment plan. So I can advertise, I can get rid of your wrinkles, basically. In Washington State, I could advertise. So every state is different, but you have organizations such as the American Facial Aesthetics that are really, through their lobby, trying to change this law all across. But then again, you have the estheticians and the plastic surgeons that don't want us doing this. So again, there's that going on. But eventually, it'll be open to all of us. Now, when I think about facial aesthetics, I'm thinking about reflection of light. How do we see each other? How am I seeing you? Well, light hits you, reflects back to me. That's how I see you. So I'm always wanting to, I always want to create good reflection. Look at this. But when you have rippled water, hence scars, wrinkles, that reflection is not happening the way it's supposed to. So I always strive for creating smooth lines when I'm doing facial aesthetics. Same patient, different lights. What a big difference. Same person, different lights, what a big difference. Of course, also, when you're dealing with facial aesthetics, you also have to pay attention to facial asymmetries. Look at the right eye. Look at the left eye. You see how they're off? Can you guys all see that? Look at the ears. Right eye, right ear is lower than left eye and left ear. So if I'm going to go in here and do some facial aesthetics from, I need to keep that in mind. So facial symmetry also is very important. The golden ratio, you guys all have heard about this. We do it for our cases, for our veneers and full mouth reconstruction. Again, look at how the eyes and the ears are off. And of course, if the eyes are off, if the ears are off, what does that mean? That means the maxilla is off. Upper teeth, upper jaw, your upper jaw supports your orbits. So if the eyes and the ears are off, that means the whole upper jaw is off. Can you guys see that here? Can you see that angle? And of course, if the lower jaw is off, the upper jaw is off, the lower jaw is off too. Again, we get into a little structural dentistry. And by the way, I've learned more about structural dentistry from Ara than any freaking courses I've taken. And believe me, I've been kicked out of a few courses too by asking too many questions. So if you guys want to shadow someone, Ara, in structural dentistry. Look at here, before and after. Look what a little lip augmentation. She wanted a little aggressive because she's an actress and she kind of pushed me into it. I usually don't like patients leaving my office and for anybody to be able to tell they had something done. And of course, right after treatments, they're still a little swollen, so that's why it looks a little more bumpy. But look at the difference in face. Are you guys seeing what I'm seeing? Yes?
Is that just PRF or is that filler?
That's PRF. Yeah, I only do PRF, but now that we have the long-lasting one, But this is PRF that would last them about a month. And then if they liked it, they could come back and say, okay, same thing or a filler. And the fillers, I also add the fillers with the PRP liquid. There's Juvederm, there's, so many out there. And they control the market. There's only, I think, 2 companies in the United States that sell the fillers. It's complete mafia. Yeah. Again, what a big difference. What a big difference. Before, after. Before, after. Again, this is just lips. And if my patient needs it, anytime I'm doing any kind of anterior composite, veneers, what have you, the lips are included. I mean, it looks like they're sisters. I mean, she goes from normal to actually pretty hot. Look at those lips. Don't you want to kiss? Of course, also my mother. This is my daughter, my niece, my brother's wife, my nephew. She would never let me take pictures. I just had to sneak these pictures of my mom. So she was actually one of my first patients, and this is my dear Aunt Homa. Again, smooth lines. So I can get that beautiful reflection of light. When I get rid of wrinkles, when I do lips, cheeks, what have you, I want to create smooth lines. So, consultation, consent forms, procedure, follow-up. I'm going to be going through this a little quick. If you guys choose to take these courses, we'll get into it much more depth in the courses that I teach. Consent forms, very important. I want my patients, pictures before, pictures after. I want my patients to know exactly where they're going, benefits, risk, what have you. Some of the tools that I use, I also make sure I document the date, what G-force, timing, how much was injected where and what, so we can keep track of all these things. The board doesn't get you for what you say. They get you for what you don't say. So I try to say as much as I can. I use ozone. Make sure, depending on the patient, they might be on a weak protocol before this. No sugar. I mean, I'm not going to have someone come and get facial aesthetic where just had a big, Big Mac, French fries, and greasy food. No. No refined sugar, no caffeine. Depending on the patient, a week or 2 before, I have a list of supplements, or I give them the supplements. No makeup. They come in, we seat them. Use ozone water, ozone wipes to clean make sure the face is nice and clean. I use steamer to open up the pores. And then we put numbing lotion on. There's a lot of ones out there you can buy. I kind of have a pharmacist compound it for me because I want it strong. I don't want to wait 20 minutes. I want to wait 7 minutes, 8 minutes. But because I've opened up the pores, now I can wait 4 or 5 minutes. I place saran wrap. What that does is pushes the anesthetic in. Then I do microneedling. I always start with microneedling. And I'm pretty aggressive with microneedling. I want to see that. I want to traumatize that face. But not, so-so. I want it to bleed. And then I withdraw blood. Now, a lot of people, a lot of the other doctors, they take the blood, centrifuge it, they put it on the face, and they do microneedling. I'm kind of the other way around because I figure if I do microneedling first, I'm traumatizing the skin, and the body's like, ooh, trauma. Let me send all these white blood cells and repair cells, and that's where I get the blood afterwards. That's just my protocol. It's been working great for me. take the blood, centrifuge it. Again, this is, let's see. So as you guys can see, we have our IPRF and APRF in the orange tubes. So the one that has more, this I would use for microneedling. After my microneedling, this I will use injecting subcutaneously or subdermally if I want to get rid of acne scars. Yes, sir. I have the gun, but you know, when you have mentors like you and Klinghard, I'm a great injector. I'll show you. I'll get in there better than the gun. The gun is good, you know, a couple $100, a little foo-foo. But I like to, yeah, I'm not a real gun person, but I have it there. Yeah. The mesotherapy gun you're talking about, yeah. I got 2 of them. I can't remember the last time I used them. So, and I do combination therapies too. So right here, these angles right here, or we do lips. So it's never just pinning. I'm doing pinning with other stuff. This young lady, she came to me, and she's like, I want cheekbones, more cheekbones. I said, no. You're going to look like a freaking, like a doll. No. But what I'll do for you is I'll shrink this area. And I'll show you guys what I did with this. We'll get there. And of course, afterwards, we put a cooling mask. Now, I'm not using the cooling mask anymore. I actually take organic coffee, put in my ice trays. So after my procedure, patient goes to the side, grabs a cube, and starts washing their face. The ice closes the pores. The coffee is a great vasoconstrictor. Again, just my own imagination. No one taught me this. You know, I just kind of put one and one together. And I also do a lot of LEDs. So what I'm trying to do is, with Casanova facelift, we'll kind of get into that light later, a little bit later. With Casanova facelift, I want also to be able to have a patient come in, listen, I have a modeling gig tomorrow, I'm going to a wedding tonight, I got to take some family pictures tomorrow. I don't want the microneedling. So through laser, cold laser technology, I take the PRP, you know, I do the steam, open up the pores, take the PRP, put that in, and through laser, light technology, push it in. I've been also getting good results. I'll show you guys in a minute. This is where we're going subcutaneously to get some of these acne issues. This is that young lady again. Remember the one I told you guys? I want cheekbones? No. Let's shrink this area up, rejuvenate this area, and it will bring the cheekbones out. The facial cream looks, the numbing cream looks not even a twitch. So she's numb, she's not feeling anything. Maybe a little pressure. This is when I'm doing lips. There's many different ways you can do lips. This is just one way. And she's numb also, she's not feeling anything. Are you okay, dear? Some before and after pictures. Only 2 sessions, 3 weeks apart, post-pregnancy discoloration and acne scarring. Now, I have pictures of when I did 4 treatments and some other work for her. You won't even recognize her anymore. When she went home, her husband didn't recognize her. A little bit more challenging, 4 sessions, but you know, I can't treat you when you eat Taco Bell. You know? Lips before and after. Again, just a little touch-up. This was one of my old assistants. And look, I haven't done much. I just plumped it up a little bit. And this is, again, a little swollen because it was right after it was done. But look what a difference it makes. So basically what I did in this case, I took the attention off her nose. By giving her lips, I took the attention off her nose. Just some anatomy, pathology, histology. These are what we go through. So I get a phone call. Well, we'll get into that. Again, this is when we're using PRF for the lips. I'm injecting with the right, and with the left, I'm molding it. This was my ex-hygienist. She saw me doing these cases, and she was like, I want some too. Of course, I always make sure that I always schedule one of these patients with any other new patients that comes into the practice. These women walk out of my practice, and when you have a new patient, what are you doing in that room? I'm like, you don't care about that stuff. That's just, well, I want to know. Facial aesthetics. So, same patient calls me. You can't believe what they've done to me. Like, what did they do to you? They injected my lips. That's ugly. I would never do that for a patient. So come back to the office, and I melted it. You have enzyme that you're able to melt fillers. Much better, huh? And she eventually became a patient of mine too. Like when she was a patient, now we're doing wisdom teeth extraction for her and other restorative work. Again, some before and after. This is the young lady with the facial acne. Again, lips. Look, what a big difference. Look at this. All of these are gone. You guys are too quiet. This young lady wouldn't even leave her house. So she would only come to my office if I closed it, there was nobody in there. Yes?
Any experience with basal cell carcinomas?
No. Not right now. I need to, in the future. This case, I actually also used ozone because these red spots are either viral or bacterial or fungal. And I know ozone kills all of that. So this is helozone. Who knows who the helozone? Yeah, I got 2 of them. I'm in research with Dr. Edward Lynch. He's in Las Vegas right now. So not only I injected ozone subcutaneously, ozone gas, but I'm also doing superficially. Got rid of the red first, and then started my micro needling. Big difference, huh? Big difference. Before, after. This is just laser. There's no micro needling in this case. Before, after. She just doesn't want micro needling. She's a Lyme patient, poor thing. She has to be very careful with every little thing that she does. This is a model that comes to us before and after. He just wanted a little lift before he takes his modeling pictures that day. I met him at the office at 5 a.m. because he would start the shooting at 7 a.m. Again, all he wanted was a little nip tuck, again, vampire facelift. I'm sorry? Yes. So, wrinkles, dry, stretched skin, problematic skin scars. I can relate anything to dentistry. If your foot hurts, I can relate it to dentistry. So I don't have a problem justifying this work that I'm doing. A lot of our TMJ patients coming in with just intense muscle, the skin, and all we're doing is rejuvenating it for them. So in all my TMJ therapy, all my structural, this is a part of it. It makes the patients feel great. It is addictive, though. So they come back asking for more. Yes, ma'am?
What laser are you using?
I'm using simple cold laser. Basically, I'm using something like this, but 700 megahertz. If you look up NASA cold laser, that's where the research is. NASA is using simple lasers for their astronauts in space to help rejuvenate muscle tissue, vascularization. Some background, I'm going to go through it pretty quickly on people that were being part of PRF and PRP. It's used in multiple different fields, and it was actually the orthopedics that got FDA approval, and then we were able to use it and what have you. Again, just a little history line. Now, this has been huge, hair growth with PRP. I only do a few cases for private patients, but I consult other medical doctors with bigger cases that I'll show you guys. It's amazing. It takes longer. It's amazing. Look at that, you guys. Before, after. One application of PRP. I can go on and on. So there's a lot of application in above and beyond the dental field. Now we get into plasma lifting. This is where my patients come in and get trained in Casanova facelift, where we strategically inject PRP, PRF, what have you, into these certain areas to help rejuvenate and give youth back. I want to thank you guys for listening to me. I do have a book, The Good Dentist. This is my information. If you have any questions, as I said, I do in-house training where I either come to you, you come to me, and we follow all different types of dental protocols. Any questions?
If you have a question, please come up.
No questions. Great. I don't know if that's really good or that's really bad. I'm sorry? Systemicdentist.com? Systemic? Right here. Oops. Oh, the top one, you're right. This one. No, this is the correct one. Systemicdentist.com. Or you can go to dralirezapanahpour.com. And I think this is my book, The Good Dentist. Yes, ma'am.
There's so many lasers, cold lasers, from 200 to 10,000 and even more. Can you just restrict it and give us the brand?
Yeah, I just did. Go on Amazon and on internet, look for 700 megahertz. It looks like a pen basically. Same thing as this. This is about 30 megahertz, maybe 15, 30 megahertz, what I'm using right now. You want the 700 megahertz.
What was the technique for the alopecia?
Alopecia, yes. Basically, what we did was we got the blood, we centrifuged plasma-rich protein, 1,200 Gs. I think it was 8 minutes. You put that in a warmer for 10 minutes at 55 Celsius. I'm sorry, 55 Celsius. That makes it to a jello, but it destroys all the proteins in it because of the heat. Now you have another PRP liquid that you've centrifuged at 700 G-force for 4 minutes. You mix it. You have to wait till the gelatin completely cools down, by the way. Completely cools down. Then you mix them together. Actually, you know what? Let me go back to the slide here. So as you guys can see, we have our IPRF. and APRF. So basically, you're warming up the APRF to make it to a gelatinous kind of a compound. And I'll show you guys the... There you go. This is what it looks like. Okay? So I warmed it up. I add the other one slowly, about 10, 12 times, back and forth gently. And then you can make your resorbable membrane, filler, what have you. Plug. Especially for our patients that don't want, anything that's bovine or, monkey bone, cadaver bone, cow bone, what have you. This is the way to go. The horizontal centrifuge alone has increased my speed recovery from my surgeries literally by a week. I have patients calling in right now. Oh, I'm supposed to be there next week to take my sutures out. This is itching like crazy. I feel like we need to take the sutures out. They come in, of course, sometimes I'm not there, my associate is there, or my nurse is there, takes a picture, sends it to me. This tissue wants to close. But the non-resorbable membrane and the sutures is irritating that area, so we remove it. So that horizontal with these new numbers has definitely increased my healing recovery. Yes, sir?
Why do you use a non-resorbable membrane versus a PRF membrane?
For that previous case? Which case?
Yeah, I would do PRF.
Well, because I didn't have this. Now I have this. I will use this now. But when I need to create a buccal wall, my only choice was use a non-resorbable membrane, pin it on each side, cover it, grow it, go back, take the pins out, close it up again. But now that I have this, again, everything has its limits. One thing that I've learned through, almost 25 years of dentistry is every protocol, every equipment, every theory is as good as the operator. Correct? Yes? No? A friend of mine, very foo-foo advanced periodontist, just bought a $500,000 laser. Hey, Alireza, what? I got freaking more root canals coming out of my practice than I don't know what to do. I'm like, it's obviously you're overdoing it. You're just heating these teeth up too much. You know what he tells me? Yeah, I think I need to get an endodontist come and practice in my office. He's going this way. I'm trying to. It's okay if these teeth are dying. I just need to get an endodontist, so not only I can bank on it. And he's got a huge heart, beautiful heart. He's not a bad person, but he's programmed that way. Any other questions? Yes.
Hey, do you only deliver with a needle, or do you use a cannula?
I use cannula. If I'm in an area that I'm like arteries, veins, what have you, I might use a cannula, but that's quite rare. I want to take a picture of all you here for memories. Yeah? Could everybody say hi? Really? Come on. Hello. Hey. Thank you. Thank you. Yeah.